3 to 5 right here, sorry. Now, what happens is that when the replication happens, right? Now, there's going to be two things. These guys is obviously going to be what? This is going to be my positive single-stranded RNA right here, right? It's a positive sense, this one already. And so as this is exactly matches. But this one does not match this one because this is going from 3 to 5 prime. These are called antisense, okay? Antisense strand. Or you can simply say this is a template, right? This is a template strand now, and which is a negative strand. So what happened, because the negative strand, what happened, they have this a lot of like the discontinuous, okay, discontinuous sites here, because this is going to replicate and make another protein right here, okay? We'll have no problem. There's a problem is here, okay? And because there's a problem here, what happens is that this is where the RNA-dependent RNA polymers are required here, okay? And what happens is the RNA polymers, let's just write it this down, RNA dependent RNA polymers comes in, and what happens is that it started like synthesizing, or it started like helping the process of this replication. So that's what it does, right? And that is gonna when the RNA-dependent, the RNA polymers come and it started working on the different sites, it's going to start synthesizing different sort of a protein, okay? This is a different sort of protein. Let's make this as, okay, let's make this in different color. Maybe like it will make like, okay, we have, maybe this will make another M protein here, okay, and this, maybe it will make another like E protein right here, okay, and what is the other one? Spike protein will make it, and they will also make like all the type of protein, like you know, the matrix protein, or like encapsulate protein, all that kind of stuff. They will start doing that, okay? And that's obviously with the help of the RNA-dependent polymers. And it's important to remember, because remember, guys, there's investigation going on. Maybe there are drugs that could work into this. Same thing with the transmembrane, receptors here, okay? There could be a drug that could be working. So TMPR, SS2, right? That's the receptors. Receptor, right? Now, this could work into that. And basically what happens is that now this process, this was going through the transcription process going, okay? Transcription process, and they also call this is a subgenomic, okay? Transcription process is going on here. And then they'll make a lot of this, like after this process, what happens, they're going to start, let's just quickly say, let's not go super detailed, but they'll start making a lot of this different types of proteins here, okay? And the same thing with this one also, different types of protein here, okay? Now, what happens is that, but remember guys, all these things, okay, let's just quickly say right down here. So what happens is all these guys will go to the, what happens is rough endoplasmic reticulum, okay? They go to rough endoplasmic reticulum, okay? Because that's where all the translation happen, right? All this translation are happening in the rough endoplasmic reticulum right there, okay? And then what happens is that from the rough endoplasmic reticulum, what happens is they sort of form like sort of immature, they'll get this, all these, the virulent particles, okay, they will get mixed with the genomes, okay? And they will replicate and make all the genomes, and then they'll go and then they'll get to the rough endoplasmic reticulum, and after that what happens is that these guys will get go to the Golgi apparatus, okay? Let's just make this like Golgi apparatus right here. And then Golgi apparatus, what happens is that these guys will get packed, okay? And they will pack together, okay? And they'll make a they will get packed together, and they'll come as virulent offspring, or virion offspring, or you can simply say the progeny, okay, virion offspring. So what happens is that they'll come out as this, because that's what they get mature. And from there what happens is that through the exocytosis process, they'll go out, okay? And when they come out, when they pack together, they look exactly like this particle right now. Now when they come together, they look exactly like, if I make this, they're going to come look exactly like this particle right now here, okay? That's how this process works, okay? This is how the virus is actually going to make a lot of this, the virus particles, okay? And this is how this process works. Now, the quickly I do have to talk about is that, okay, one thing is that whenever these cells are there, right, a couple of things, I quickly mention, there's a virus particle here, right? Now a couple things what happens, normally, really what happens is that, now this cell is infected, right? Now if this cell is infected, because there is going to be this, this virus is going out. And usually what happens is that, if the cells that detects there's some kind of like a viruses is there, then usually how cells response is that, okay, let's just quickly talk about this. What happens is that there's some host cells protein, okay? This host cells proteins, they recognizes this important guy right here. Okay, some of the host cells proteins, they recognizes this particle right here, okay? This genome. And when they recognize some genome, what happens is that they're going to go activate this protein called in a mitochondria. Okay, in the mitochondria, this protein is called is a mitochondria. Okay, it's a mitochondria antiviral proteins. Okay, it's a viral proteins. So the mitochondria antiviral proteins, they're going to synthesize, they're going to activate this. And what this mitochondria antibacterial proteins, what it does is that this is going to go. And what it does is that it does two things, okay? One thing it does is that it's going to go and activate this protein called ubiquitin kinase, okay? It's a ubiquitin, let's say ubiquitin kinase. That's what it does, right? And what is ubiquitin? Let's just go with this. The MABS protein, let's say, it activates the ubiquitin kinase. And this ubiquitin kinase does two things, okay? One thing it does is that it goes and then activate the transcription factor, and especially this transcription factor, which is called NF-kappa. Okay, let's just make this NF-kappa B. Okay, and this is a transcription factor. And once it gets activated, what happens is it goes to the nucleus. Okay, let's make this as a nucleus. Okay, and then it goes to nucleus, and it works with the NF-kappa B response elements and started producing what? Pro-inflammatory cytokines. That's what it does. That's what it will making, okay? And what are cytokines? Cytokines are basically, these are chemical messengers, okay? That's what these guys are gonna do. And also what ubiquitin kinase does is that it goes and activates by, what does kinase mean? You put a phosphate, right? It phosphates certain sort of like a protein, which are called, okay, interferon, okay, regulatory factor. Maybe there are going to be 3, maybe interferon regulatory factor number maybe 7. Okay, they'll phosphorylate this, and when they phosphorylate this, what's going to happen is that these guys will go and then work on the interferon gene. Okay, let's make this interferon gene, and what happens is that when they stimulate the interferon gene, well, it will start producing a lot of this interferons. Okay, and what do interferons do? Okay, let's just quickly talk about that too. We'll come back to You'll come back to this pro-inflammatory, and still this is happening in the cell right here, okay? And then what these guys do is like, look, if it's interferon, normally what interferon does is that, look, if let's say this cell is infected and this cell is producing what? This infected cell, let's just write on the infected cells, okay? So infected cells is producing what is called interferon, right? When the infected cells produce interferon, what happens is this interferon goes to the nearby cells, okay? So let's say the other nearby cells it goes to, let's say this is like another cell here, and what happens is that it started coating interferons on the surface here, okay? Let's just make this interferon right here. It started coating the interferons here. And once start coating this, these other cells are coated by the interferon, these cells are going to secrete those antiviral proteins, okay? They're going to say so antiviral protein. That's what these guys do. Which basically, so if you're making, now these guys are making antiviral protein, and what antiviral protein does? Antiviral protein, isn't this so-called, this antiviral protein will prevent this process. Let's just make this guy, it's prevent to hold the replication to occur, prevent multiplications of the genomes, like all these things right here. It will prevent like sort of like the virus to multiply, okay? That's what it does, okay? So that's what it does. Usually this is how it works. So people who have been like, recovered by the disease, I'm pretty sure that, for those people, the interferon level, especially those, there are different types of interferons, by the way. There's interferon alpha, the interferon gamma, okay? The interference levels are probably going to be a lot more higher on those people, because they have, they sort of maybe made this interference, and they were able to what do you call, come from these viruses, right? But but life is not always easy. What happens is sometimes sometimes what happens is that these viruses are crazy, because what they do is some of these proteins, like this M protein especially, it can inhibit, like this M protein sometimes can, what happens, it can inhibit this ubiquitin kinase, and if you can inhibit this ubiquitin kinase, what happens? It would not able to phosphorylate this NF-kappa B, and also it's not going to phosphorylate this interferon, so you would not able to synthesize antiviral protein. Okay, these guys, they can do that. Okay, and also, like, sometimes what happens is the host protein, which can recognize these viral particles, if they were bound with those N capsid, what happens is that maybe sometimes the viral protein would not even able to recognize that. Okay, and if it's not able to recognize that, maybe it may not able to even activate this NF-kappa B, and you would not even able to make the pro-inflammatory cytokines. Okay, and pro-inflammatory cytokines are kind of important. Okay, but this is general, like the sort of like a pathology of how it takes place. Okay, now after that we'll talk about this. Okay, now let's say that, okay, we are able to make those pro-inflammatory cytokines. Okay, what happens? These pro-inflammatory cytokines, what happens? They get released. Okay, they get released, and we'll make it. Okay, let's just make this here. These pro-inflammatory cytokines are released, right? And this pro-inflammatory cytokines, what happens is they're sort of like, it stimulates, like, because there are macrophages down here, right? Which are alveolar macrophages and all that kind of stuff, right? And let's make this as a different color, which is the alveolar macrophages. Okay. What happens is those are kind of like circulating there, and what happens is that they will get stimulated, or maybe they'll react into this, and what happens is that they'll also what happens is that they started also secreting some other kind of like cytokines. Okay, so what happens is, let's not go like super detailed about it, but just to get the concept here is that, let's say these are macrophages right here. Okay, these are macrophages. Okay, and these macrophages are what they do is that, okay, they will secrete some of the important interleukins. Okay, and what they do is, like, they play a very, very important role, because with cytokines, what happens is sort of like they will stimulate macrophages, or macrophages will respond to this infected cells too, right? And then what happens is that they'll stimulate some of the very, very important interleukins, and one of the most important, or two of them actually, are going to be your interleukin number 1B, okay? And then other one is like interleukin 6, and then tumor necrosis factor alpha, okay? These are very, very important. Okay, the couple of functions of this one. Okay. Now, one of the things is that whenever there is an interleukin 1 alphas are released, first of all, they work locally. Okay, what they locally do is what? Okay, let's just now we have to talk about this. Okay, if I make, okay, okay, we'll make it here. We'll make this as a little bigger here. Okay. You'll make it a little bigger here. And we'll make it this way, and we'll make a little bigger right here. Okay, and what happens, I'm making alveoli, and there's bronchi right here. Okay, and what happens is that, okay, we'll make this one right here, and these are my blood vessels right here. Okay, what happens is that, first of all, okay, this blood vessels is like this, the endothelial cells, like pulmonary capillaries, and then what happens is this interleukin 1B, tumor necrosis factor, and then also what they do is that they go this in endothelial cells, okay, and it causes vasodilations. Okay, not only that, it causes vasodilation. Not only these guys cause vasodilation. Also, one more thing. Remember, guys, I was talking before that. I told you about the increased level of angiotensin number 2. Okay, remember, because we have a less number of angiotensin number 1. That's angiotensin number 2 also plays a role in here. And what is the role of that? Is that it's binding a certain receptor. Because remember, angiotensin 2 is a powerful, is a vasoconstrictor, right? But what happens is that this angiotensin has receptors in here, which is like type 1A receptor. What happens? And what it does is that it can cause, okay, it can cause vasodilations, okay, by binding the type 1A receptors, okay, and sometimes like angiotensin and 2 can stimulate like production of nitric oxide too, okay. So basically the whole idea is it causes vasodilations, and when it causes vasodilations, look what happens. This become highly porous, like this, and then what happens is that these guys, when this becomes sort of like become like highly porous, and then whenever this blood vessel dilate, what happens is that the blood movement is going to be higher, so that's the reason why you see redness will occur, okay. And then whenever this blood vessel is also vasodilated, what happens, that creates a gap in between this endothelial cells, okay. And what happens is that now this become what, highly increase in vascular permeability. Let's just write down that increase in vascular permeability. That's what happens, right? Now, if it's an increase in vascular permeability, what's going to happen? Let's just make it here actually. So if it's making an increase in vascular permeability, what happens is that a lot of fluid can leak out from here. Okay, a lot of fluid can go out here. So now the fluid is going to be kind of get accumulated on the interstitium. That's what is going to happen now here. Now, what else it can does is that this macrophages, not only that they release this cytokines, they also release something called chemokines. What are chemokines? The chemokines are basically, those are, let me write down some of these chemokines, which are one of the known is called CXCL10. There's also CL2. And what these guys do is like, they sort of like a guide, especially neutrophils, like immune cells, to where to go. Like for example, if there's a problems are happening down here and neutrophils are here, how the neutrophils get here, that is actually guided by the chemokines, okay, and they play a very, very important role into here. Now, not only this, and this is locally they are doing right now, okay, locally this interleukin 1, 6 antinucleation factor, even angiotensin 2, they're locally playing a role causing vasodilator and increasing the vascular permeability. That's what these guys are doing right now, right? They also have receptors, this interleukin 1, they also sort of like stimulate endothelial cells, and what happens is that when they stimulate endothelial cells, what happens is that there's certain receptor, they'll get kind of like popped out on the surface of the endothelial cells, okay? And those are like selectins and integrins, okay? In immunology, we'll probably talk much about that, but basically what it does is that they're already like abundant amount of neutrophils, because neutrophils are abundantly present in our system, right? And what happens is that the neutrophils are going to come and bind to this proteins, the selectin proteins, and also they're going to bind to the integrins. And then the neutrophils especially show this protein called CD31 or something. And what happens is that the whole process, we're trying to bring the neutrophils here, okay? Because the monocytes is calling for help, and that whole process, this when the neutrophils, let's make this a neutrophils, when this goes from this area, from the blood to the tissue area, we call them a diaperesis, okay? This is how the neutrophils travels, and with this CXCL10 and CL2, what happens is that it get to where the damage and inflammation area is. That's how the neutrophils travels, okay? Now, that's a basic thing I want to tell you, okay? Let's not go super detailed about it. Now, neutrophils are here, okay? And remember, when the neutrophils are here, what happens? The neutrophils are going to start trying to like, clean up those bacteria and all those infected cells. That's what these guys do. And this is like, let's say this is like a low amount of interleukins or interleukin 6 or tumor necrosis factors are producing. That's what these guys usually do, okay? That's what happens. And then they try to clean up. But let's say that's like a moderate amount of this cytokines are producing. Then what happens is that especially this interleukins 6, 6, and 12, what they can do is that they can go, okay? They can go to very, very important organ. And you know what that organ is? It's called brain. It's called what is this called? All right? It's called, and we'll make this a little bigger actually. It's called brain. If you make a brain right here, okay, what happens is that, okay, these guys go interleukin 1 and 6, all of them go to actually hypothalamus. Hypothalamus are blood-brain barrier. How interleukins are proteins? Can they travel? Can they actually go there? Actually, they can, because remember, there are some of the areas in your hypothalamus, okay? The blood-brain barriers are physically non-existent, okay? They don't exist there, okay? So from there, those interleukin 1 and 6 go there, right? And you know what these guys do? When they go here, like if you now remember what is this? You have blood-brain, hypothalamus, whatever, you have anterior pituitary, you have posterior pituitary, right? And there's infundibulum, and then you have a gray sheath of matter, right? What is this? The gray sheath of matter right here. Okay, this is hypothalamus, and they also have mammillary bodies right here. And this guy sits on the sella turcica bone, if you remember that, right? If you're good at neuroanatomy, right? And then what happens is that in the hypothalamus, what happens is that they will stimulate like a certain cell. The interleukin cells will stimulate some kind of like the hypothalamus neurons, like the endothelial cells on there. What happens is that, and they'll start releasing prostaglandins E2, PZE2. Okay, the prostaglandins are released here too, okay, by the cells, but this prostaglandin is different than this one, okay. This is by the interleukin 1s and 6 and all the tumor-necrosis factors alpha. They are stimulating the endothelial cells here, and because of what happens is that this PZE2 get stimulated here, okay. The PZE2, what happens is that PZE stimulated, what it does is that it stimulates the thermostats. Okay, and they stimulate thermostats, and by this stimulating thermostat, what's going to happen that it's going to increase what? Then you'll have fever. Okay, that's what fevers are. Fever happening. Okay, fever happen, and they also do certain things. And because now they alter the hypothalamus. Okay, so because of this, the people who have this, they might even like maybe lost their appetite. They may not like to eat food too. That could happen too. But the main thing, then one of the main common symptoms you get to see is people with them is a fever. Right? That's how the fever occurs in these people. Now. After that, what else can happen? Other thing that's going to happen is a couple of things. Okay. Now, remember, this is fever right now, right? What is happening? Look, now fluid is keep going down here, right? So fluid is keep accumulating on your what? What is this called? In an interstitium, right? Whenever fluid is accumulating in interstitium, what is going to happen? That's going to create. Remember how the lungs normal first. How the normal usually works. Okay, let's just quickly make this. Okay, usually if this is my lung right here, right? And then what happens? You have this layer, which is called parietal layer, and you have what? Thoracic cavity right here, right? This thoracic cavity. So what happens? And there's a diaphragm here, right? Okay. And really, what happens is usually diaphragm contracts, it pulls this parietal layer, right? And there's a negative pressure here, right? But if the interstitium is, let's say, this interstitium, what? If its fluid is building up, right? What is going to happen? If the fluid is already building up here, what's going to happen? That is going to cause the positive pressure. That means whenever